Welcome to Lilac Dance.
A podcast by two disabled artists about creative expression and processing emotions.
My name is Elena, and I am a writer, musician, and sometimes an artist.
My name is Heather, and I am an artist and a dance educator.
Awesome.
So, what have you been up to since the last episode?
I mean, it's been a minute. We've decided this is our season two
Yeah,
since we have a
welcome
little
to
break.
season
Yeah,
two.
welcome to season two. Um, yeah, I've just been, it's been summer, so I've been just in a couple classes, but other than that, I've been just kind of just living life. How about
Nice.
you?
I look forward to hearing about those classes today.
Yes,
That
yes.
will be
You've
nice.
got some exciting things coming up
I do have some exciting things coming up.
and going on currently.
And
Yeah.
going on. I guess, I've been teaching the dance,
Yeah.
teaching to disabled and non-disabled people, some in-person things, some virtual things. It's been good.
Yeah. Oh my gosh. I got to go to one of your classes
Yeah, you
and
came
it was
through.
so much fun. I did get super lost on the way because I still have dyscalculia, but life update. No, I'm just kidding. But yes, it was super cool. So it was really exciting to get to see your dance instruction firsthand. You're so good at teaching. It's awesome.
Thank you so much. It means a lot. And I'm really glad you could experience it and just it was a room full of people of different kinds of disabilities and not disabilities. And it was just really,
Yeah.
really cool to see people in person because I've been doing it virtual for so long. So,
Right. Well, and it
yeah.
was so cool to see how you were able to like include everyone and people with different, needs for accommodations and different, things that worked best for different people. And you really were able to like make it work. It was awesome.
Thank you so much. That kind of really leads us into our first topic of the day, um, which is about what I'm up to with dance. And I know, I always announce at the beginning of the podcast, like, I'm a dance educator or I'm a dance teacher, but I don't always give like those details. So today I want to like talk a little bit more about that. Um,
Yeah. So you have kind of an exciting thing coming up. Tell us a little bit about that.
yeah, so what's coming up is that I'm going to be continuing my education as a dance teacher, and I'm going to a week-long dance intensive for disabled and non-disabled people in Atlanta, Georgia.
That is so cool. So, what are you most excited for?
Well, I feel like for a long time now, I haven't really had a lot of mentorship in dance from someone who has a disability too. Now, I've had some mentors that mean a lot to me that don't have disabilities, and they have helped me immensely. But when it comes to me figuring out how I can move my body, I haven't really had that specific guidance.
Right.
So I'm expecting to go to this intensive, and I already kind of corresponded with like the executive director, and I said, "Hey, like I need to be able to not only sit, which is going to be common for a lot of people
Mhm.
there, but I need to be able to have a space to lie down in, and I
Yeah.
need to be able to lie down in a place that's like raised off the floor, like whether that's a cot, a
Mhm.
bed, a massage table, like whatever it may be. Even a reclining lawn chair would work."
Yeah.
Like I don't know like what they're gonna have for me, but I said like, "Hey, I'm gonna need this accommodation." And they were like, "Okay, like we'll get to work and we'll let you know if we have questions." So I'm expecting when I get
Yeah.
there for there to be a place for me to lie down and that I can explore that dancing while I'm
Mhm.
lying down.
Yes, because that is very possible to do. You just had a performance where a lot
Yeah.
of the dance took place laying down, if I'm remembering correctly. So,
Yeah, you're right. It was
yeah.
like maybe like 60% of the dance performance was lying down, which I should also mention here.
Yeah.
I did perform at a dance festival. The dance festival was put on by Terpsichore Collective, and um I did a performance in a show with other dance professionals, and I was, I think, the only disabled dancer in the show, so it was really amazing to represent. And I lied down for 60% of the dance and then I sat up for the rest of it. So that was really, really amazing. So that was almost like step one of this like leveling up of my dance performance skills. And so now this dance intensive that I'm going to is like kind of like step two, three, and four
Yeah. Oh, that's
of
awesome.
of that. And then just because I'm neurodivergent, I just heard myself say step up, but like steps and referring to stairs is like totally
Oh,
like not accessible language,
that's a
maybe.
good
I mean, I
point.
guess we use the word step like very commonly in the English language,
Yeah.
so maybe like we don't need to worry about it a lot, but like in
Yeah.
thinking about where that word comes from, it probably just comes from stairs.
That's so true. I mean, I guess we could say like level up
Yeah,
because
level
that could be
up.
an elevator too, maybe.
Yeah,
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 level up.
yeah.
I'm leveling up in an elevator.
Moving up a floor. Yeah,
Yeah.
there you go.
Yeah, yeah.
It's a good
Yeah.
point though. I never thought about that with stepping.
Yeah.
I'm gonna be aware of that now.
Yeah, I know. I was like, oh, is it my ADHD that I want to like interrupt what I'm talking about to talk about the thing that I just noticed?
You know,
But
if it is, we're all about that here.
yeah, we like that. We like
Yeah.
that here. Um,
So I know you were saying earlier before the podcast, before we started recording that you were really excited and there were also some things you maybe were a little bit nervous about.
yes. Yeah, thank you for asking about that. I think anytime you go to another city for the first time, I mean, first time since I was 14 and there for a wedding. So I
Right.
haven't really explored Atlanta in my adult life. You know, I'm about to be 26, like in 2 weeks actually from
Happy
today.
birthday.
Thank you.
Early birthday.
And so, you know, it's been 12 years since I've been in Atlanta and I really didn't explore much last time I was there. I was probably
Mhm.
there for like 48 hours. So I'm nervous to travel. I
Yeah.
think once I get on that plane, a lot of those nerves will calm down.
Uh-huh.
But I'm just like, wow, this is a new city and I'm doing it alone.
I know that I have a lot of anxiety about traveling alone, because of things that are related to my neurodivergence and things that are unrelated, but might be,
Yeah.
also related to like gender and other social
Hmm.
identities. But I'm assuming the challenges would be probably completely different depending on, what disability you're working with. So, does that at all factor into, your concerns about traveling? Because I know that's a huge part of it for me.
Yeah, no, I think it is. I'm planning to take a small suitcase and a small backpack,
Mhm.
and then I'm planning to attach the backpack to the suitcase so I can roll it.
Mm,
Because if I couldn't roll it, I wouldn't be able to travel because I can't carry things on my body. So
right.
I'm nervous about my ability to push my suitcase by myself. Now, I did request wheelchair access
Uh-huh.
at the airport, so I'm hoping when I get there and I go to the ticket counter and I say, hey, here's my boarding pass. I requested wheelchair service, and then they'll bring me like an attendant with a wheelchair, and then
Right.
they can put my suitcase under it so that they will wheel me around the airport to my gate with while carrying the suitcase for me. And that's actually the main reason I requested help. It's not because well, I have problems walking long distances to a point, but like in an airport at this point, I could probably do the walking. But since I have trouble carrying my luggage, I needed to request that wheelchair access so that I know I'm not gonna like exhaust myself before the dance intensive even starts.
Right.
So that's
Yeah.
like the physical kind of nervousness. And
Mhm.
then I guess the emotional nervousness is like, I'm gonna be in a room with a lot of professional dancers,
Mm,
that's nerve-wracking in and of itself because I feel like it's like kind of brings up a little bit of like imposter syndrome, like am I enough? Should I be here? Like is this right for me? And then another thing that comes up for me is like I don't know how many dancers out there are even disabled dancers out there are dealing with as high levels of pain as
yeah.
I deal with. So I'm gonna need to rest a lot of the time, and they're gonna talk about. They told me that they're going to talk about everyone taking care of their bodies during the workshop and resting when they need to.
Hmm.
So like it's gonna be integrated into the workshops, but at the same time, I'm still nervous about it because I've never been to a workshop from 9 a.m. to 2:30
It's a
p.m.
long
for
time.
6 days.
Yeah.
And yeah, I'm just like, wow, will my body be able to meet
Right.
my needs? And will I be able to listen to my body and rest when I need to? And, I was talking to my partner about this. He was like, "Yo, like as long as you're in the room, you're going to absorb things. Like
Yes.
you don't have to move your body every second that you're there, and I won't be able to because I know myself. Like
Right.
I can be active for like maybe 1 to 2 hours a day right now, like at like a moderate to high intensity, whether that's walking or dancing, seated or lying down.
Right.
But I've never in my recent history been at that 5 hour mark.
Yeah.
So I know I'm gonna have to take breaks. And I'll probably push myself at the same time as taking a lot of breaks, but because I want to push myself.
Mhm.
But yeah, it just brings up a lot of like, will my body be there for me? My body has been there for me more than it ever has in many ways,
Mhm.
7, 8 months post surgery.
Yeah.
But my body also still deals with a lot of pain in my back.
Right.
So it's a lot.
Yeah, so it sounds like, you're kind of navigating, the a potential social expectation or an expectation of like the
Mhm.
profession of dance, as well as like your own body's needs and like how you're gonna feel about yourself when you're there and what you're gonna learn. It sounds like, there's a lot of things that all are kind of on your mind right now.
Yeah, there are. And I'm just trying to ground myself in like these are trained disabled dance teachers.
Yes.
And there's non-disabled people too, but like for what I'm looking for what I'm hoping to get out of it, these are people that are highly trained in working with disabled people, so I have that going for they're
Right.
like the program has that going for it, and then therefore I can grab onto that. Like my one of my therapists says, like, what's your kite holder statement? Like the kite is flying in the
Oh,
wind, and then you're grounded holding that kite. And I'm like, okay, I'm holding the kite with like the fact that I have a lot of experience as a dance teacher. I have a lot of experience in accessible dance, and there are other people that are going to meet me where I'm
I love that. The
at.
kite holder statement.
Yeah.
I feel like I'm gonna use that someday.
Yeah, that's JoJo Diggs. Look JoJo up because they're not a like a social worker or a therapist in a traditional sense, but they build a transformative coaching program where you talk about shadow work and you talk about trauma and you bring everything in to it.
Mhm.
And so I find JoJo's work extremely helpful and accessible. And I didn't mention this before, but um the name of the dance company that's doing the dance intensive is called Full Radius Dance Company in Atlanta, Georgia. So if anyone wants to look into them, Full Radius Dance Company. And I had just recently followed them on Instagram when they posted about the dance intensive, and they ended up offering me scholarship. So
Wow, that's
I was like,
great.
that's a cue that I should go.
Yeah, yeah. Well, and it's great that they are doing things to like make it financially accessible to people too,
Yeah,
because that's also super important.
absolutely. For sure.
So when you think about just the whole experience overall, what do you hope to get out of it? What's like the
Yeah.
main thing you're hoping will come of this experience for you?
Well, I think the main thing is like increased confidence and maybe more clear of a direction.
I love that.
Yeah,
Yeah,
increased
that's awesome.
confidence, clear direction.
Hmm.
Because I think it's gonna let me know, inform like my dance pedagogy of like how I'm teaching and kind of like help me refine that. And so I feel like I'm going in a certain
Yeah.
direction
Yeah.
with it. So yeah, increased confidence and clear direction.
That's awesome. Well, and I hope that we'll do a podcast
Hmm.
episode sometime when you come back so you could update everyone on how it was and what you learned and all of
Yeah.
that.
Thank you for asking me all those questions. It helped me reflect for sure.
Hmm.
And now I'm curious to hear about, these social work classes you've been taking and like what one or both of them, whatever you want to share, kind of
Yeah.
like what starting with like what is the name of the class?
Yeah, so one of the classes I've been taking two classes. One of them is mental health disorders in children and youth, and the other one is school social work assessments, like social work in a school setting, learning about assessing. And it's one of the classes that's required for getting a certificate in work in schools.
Okay.
So both are like children focused, which is really exciting because up until now in my program, a lot of the classes have been more focused on adults, which is also great to know because most people end up working with both. But so it's been really great to have a class that focuses specifically on children. And so this class I'm taking about mental health disorders for children and youth, it has been so interesting. I feel like I've learned so many new things, and I just like the whole class I'm always just like typing, trying to get everything. But it's been really cool. We talk about how to assess for different things, different kinds of like approaches and interventions that could work for different people in different situations, how to talk to families, how to talk
Mm.
to parents, which was something that I had been really nervous about, so I'm really grateful that we covered that. Just a lot of really interesting stuff. And the professor, Aaron Martinez, was also just absolutely amazing. So
Yay.
yes, super fun experience.
So can you give an example of like something that you talked about in the class, like maybe like a specific disability and like how that would be assessed or how you would
Yeah.
talk to parents or I don't know, just some more examples would be nice to hear.
Yeah, so this class was actually really interesting because it was very tied to neurodiversity, which is
Okay.
great. Like we talked about like autism and ADHD and things that are definitely within the, like neurodivergent realm. And the professor was really great about bringing in people who were experts um and who did have, lived experience, and it was really, really great. So
Awesome.
yeah, so a lot of it was we've had some great class discussions. It's a very like discussion based class, and that's been really exciting. And one thing that's been great is that the professor has been really willing to kind of look at the DSM as, it's this book that we all use and reference, but we can and should be critical of it too, right?
Yeah.
So she was very, very open to us looking really critically at disorders that label people in really stigmatizing ways, like, conduct disorder and oppositional defiant disorder, which, have a lot of implications when you put that label on a child. And also, have a lot of like bias that are oftentimes sort of baked in with that when you look at like the demographics of, like white children are less likely to be diagnosed with something like that.
Mm.
So it's very like there's a lot that's kind of tied into some of those diagnoses that can be really stigmatizing. And what was really great is that, a lot of what we did in class was to think really critically about like, why are we diagnosing people with this? What could we do instead? How could we, find a root cause that's usually trauma behind why someone might be acting a certain way. So it's been really, really great, really important stuff. So I'm really glad that I was able to take it.
That's really cool.
Yeah.
Wow. Yeah, just my brain went to, can you remind us what does the DSM stand for?
Oh, yes, it's the
Diagnostic
Diagnostic Statistical
Statistical
Manual.
Manual.
I should have been
Okay.
able to say that way faster.
No, I think it's like totally normal when you're like already in the realm of like psychology and social work. Like I was a psychology minor in school and like nobody ever says diagnostics and statistics manual or whatever.
I
Like
don't think anyone has said that
everyone's
in my
like
entire
DSM,
program.
but
Yeah.
I just wanted to review like what that was in
No,
case
that's
people
like
were like, wait,
great
what is
point.
that? Um, because I remember I took psychopathology and a lot of what we looked at, it wasn't specific to children. We mostly talked about adults, but we talked about kind of how like all these layers of society, like what you mentioned, like race and
Hmm.
gender and
Yes.
class and you name it.
Gender is also a really big part of a lot of these diagnoses too, because certain, things are a lot of the disorders that are sort of like coded as like acting out kind of, or like sort of under the under the surface meaning is that a lot of them are more likely given to boys than girls.
Yeah.
And there's a lot there that's worth looking into, like, because the mental health professionals are by no means like immune to bias, and we're not necessarily look, mental illnesses don't exist in a bubble, and
Yeah,
diagnoses don't exist in a bubble at all. Um, exist in the context of our social biases. So that's really, really important. And I'm really glad that we went so in depth on that in this class.
that's really cool. Wow. And so you finished the class.
I just finished. Yeah, I still have to take one more exam.
Okay,
Um,
good luck.
thanks. But it was really, really interesting. I mean, I think in some ways it was a little bit tough because we were studying like conditions that I have or have had. And so
Mm.
it's like, oh man. And we would read case studies and I would look at these case studies and for some of them I'd be like, oh, this is me. Like, I mean, it's not, but
Wow.
like, very,
Yeah,
very
like you would
similar.
resonate
Yeah.
with the
So
case. Wow.
there were definitely some weeks that were like a lot harder than others. But
Yeah.
again, the professor was amazing. She was completely open to me writing a 5-paragraph criticism of our documentary on eating disorders in the
Wow.
discussion posts.
Yay.
So really, really grateful to her for that.
That's cool that you were able to do that and like
Yeah.
criticize something without judgment. That's
Yes.
really cool.
Right.
Wow.
So it was a really great experience. I wish it were longer.
Yeah, it's just making me think, like just coming back to like what you said about like boys being diagnosed with things
Mhm.
greater than girls, like it harms everyone,
It harms
and
everyone.
not just the
Exactly.
boys, because like then girls like are being overlooked.
Right. Like chances are, there are probably a lot of girls who have something going on. Like it doesn't
Yeah.
mean that they should also be labeled with oppositional defiant
Right,
disorder, but
right.
like maybe there's, the treatment maybe is what's
Yeah.
needed. Yeah.
Or like I guess my brain went to like ADHD. Like for me, ADHD was overlooked until I was 16, and the only reason we like really figured it out is because like at this point everyone in my family had it and I was like the youngest,
Mm,
so we were just kind of like, oh, yep, yeah. But like I have memories of being in fifth grade
yeah.
and not being able to, like, I can read, but I can't read. Like it's hard for me, and I realize now like I like audiobooks, but
Hmm.
there wasn't that access when I was young.
Right.
And so the zoning out when I was like, it was silent reading time in school, and I'd just be zoning out. Like I remember from fifth grade on, like I'd just be zoning out all the time. And then, sixth grade on, I had like other disabilities come into play, which kind of complicates things because when you have multiple disabilities, maybe one gets looked at more than others. And I don't know if you were
Yeah.
studying that as well, like people with multiple disabilities, but yeah,
That's a great point.
there's just so many things to consider, and it's cool that you were learning about things that will hopefully benefit children who work with you in the
Yeah,
future.
I really hope so. And I think we also I mentioned earlier, but one of the other really helpful things that we talked about was just how to interact with the whole family. And how to respect the whole family even if you don't always see eye to eye with the parents.
Okay.
Even if, you don't agree with what the parents are doing, how to kind of bring that up and engage with them in a way that's not going to like alienate the family you're working with. And that was super helpful because that's always been
Yeah.
something I've been concerned about. Like, what do I do if the parents just like hate me because, I see something, I have a different perspective or, whatever it might be.
That's awesome that
Yeah.
we're learning that, because yeah, I remember when I was working in a school, with like very little credentials at all. When I was 18, I was like serving in the AmeriCorps with and working with the organization City Year, but I was basically a tutor.
Yeah.
But like the parents would come to me, and I had no training about like how to deal with parents because they were like, well, the teacher should be doing that. But it's like, well, what if the teacher is busy? What if the parent still comes to you? And I didn't have that experience. So it's good to hear that like that's in your training and that you're not going to
Right.
go forward like not knowing how to handle parents, because when you work with a kid, like parents are involved.
Yes. Well, and absolutely. And, I think what's helpful for me to think about, and this was sort of something that occurred to me over the course of this class, is like, you know, if the parent is there having their child go to therapy for some kind of mental health issue, they're already at least one step of the way or
Level.
one level of the way there. um one part of the way there. They've already done the first thing. And so I feel like that helps me to kind of like, sort of ground myself in that knowledge a little bit of knowing like at the end of the day they're here because they want what's best for their kid and we might disagree on what that looks like. But knowing that helps me to think more like we can find ways to work as a team even if we're not agreeing all the time or whatever the case may be. I don't have a lot of experience working with parents, so I don't really know. But
Right.
yeah.
Well, that's really cool. Is there anything else you'd like to share about the class or classes that you've mentioned?
Um, I think just, it was just really great to have something to occupy my brain over the summer and it was a good experience. I wish I'd been able to take more. But yeah, it was good.
I'm sure having a little bit of a break, like not 4 or 5 classes at once, just 2, maybe that felt good.
Yeah, I think it did because I think, 4 or 5 maybe would have been a lot of work.
Okay.
Yeah, I think I do not like unstructured time. We were just talking about
Yeah.
this earlier. I hate summer like and for that specific reason because I if I don't have like a place to go every day and I know what I'm gonna do and I'm like busy and my mind is always occupied, I'm like, ah, I don't like this. So I'm looking forward to getting back to a full schedule of classes, even though I know when that happens, I'm gonna be like, I'm stressed, but
Right.
you know.
Right. Well, I'm glad that you know yourself and then can look
Right.
forward to when things get a little busier because it does provide that structure.
Yeah.
Awesome. Well, I feel like this concludes our
It
episode.
does. Yeah, I was trying to remember if there was
Did we
anything.
touch on
I
everything?
think I think
I
we got
think
everything.
the
Yeah.
other thing I want to say about this step thing, step versus level, is like step could be on stairs, but step could also just be somebody walking. But not everybody takes steps, is another thing
Right.
I realized. So I could be overthinking it, but there is something to be said about
Yeah.
language that we use all the time. And like in dance teaching, I'm always like, travel or stroll because if somebody's in a wheelchair or power wheelchair, traveling a different way than what I do, like I don't want to say to walk because like
Right.
not everyone's going to be walking. So I want to be mindful of language like I'm mindful in my dance classes. I want to be mindful of language all the time.
No, I think it's a
Yeah.
really, really good point. And there are other areas where I think people have already started to kind of like adapt language, and I think that might be um the next area of I was about to say the next step. I really am gonna have to work on this one. The next area of language to start to adapt.
Yeah, and it
Yeah.
could be fine to say that. Like, I don't know. Like, it's just worth considering.
I think that your point is very
Okay,
valid. Yeah,
okay.
yeah.
Cool. I'm glad that during this podcast we can investigate language.
Yeah. Oh no, I love investigating language.
All right, everyone. Peace out.
Bye.